Happy Thursday, everybody. I had a physician come and see me, and the question was that he had been told that his blood work was normal, and he wanted to know why he was still so exhausted, couldn't think clearly, and a lot of times he'd go to bed, and when he woke up, he felt like he hadn't slept. And so imagine that could be quite annoying. Uh, and his blood test, according to his primary care doctor and everybody else, and himself being a physician, were quite reassuring. And he had been told that there were really nothing necessarily wrong with what they had looked at. Uh, and his question to me wasn't more of a consult, was more of a hey, Dr. Isan, you're an oncologist, hematologist, you do internal medicine, and what's going on? What's missing here in my health picture? And he basically looked at me and he's like, fatigue is not a diagnosis, malaise is not a diagnosis, and so I want to talk to you about this. So I went down a list of 5 areas that I consider that are worth exploring without driving you crazy. One is first and foremost, poor quality sleep. Ask yourself, do I snore? Ask your partner, do I snore? Do I does my partner say you wake up gasping for air? Do you feel like in the morning your mouth is extremely dry? Uh, the whole sleep thing is really an issue, and in a lot of people, once the sleep issue is addressed, a lot of other things go away. Uh, Number two are medications and substances, in my opinion, and some of them, we get used to taking sleeping aids, allergy medicines, pain medicines, and they could make you fatigued and uh, kind of uh, not yourself. So that's another thing you need to pay attention to. And it becomes a vicious cycle where you go from, I'm tired, so I'm going to go get an energy drink, I'll drink more coffee, and, you know, just get through the day and hopefully I'll feel better tomorrow. So, up to this point, one thing I want you to remember is make sure the sleep thing is addressed. And what are things that, as an oncologist, hematologist, I recommend is generally other stuff. And what is that? Chronic stress. Everybody is dealing with it. Burnout. Genuine physical exhaustion from it quite happens often amongst people that work. I mean, try driving in Los Angeles. Anxiety, depression. And that's not just for other people. You can have a legitimate reason to be anxious or depressed, but you could also have this imaginary worry that makes you anxious and depressed. And sometimes you just got to let those thoughts come in your brain and leave. Or if it's something you haven't dealt with, deal with them. And the other thing I told my colleague was, sometimes it's okay to let a bad thought or anxiety come and go as a bad movie and not really pay that much attention to it because you're making it all up anyhow. The other thought that I had was, did this happen right away? Did you have COVID? Uh, do you feel tired after you've been on TikTok for a while or any of these apps and all of a sudden the dopamine is sucked out of you? And so, even though this is so general, it's interesting. Sometimes I have a normal bone marrow biopsy and the patient just doesn't feel good. They don't feel refreshed, and it's because all the other basic things have not been addressed. So, first and foremost, what's the good news? You got normal blood. You don't need a bone marrow biopsy. You don't need to see me. You're not going to need, to look for anything crazy. Number two, do your basic stuff: mammograms, ultrasounds, bone densities, colonoscopies, endoscopies, etc. All of those things matter. Basic blood work. Second, don't panic. Third, make sure you're sleeping well. And if you're not, find out why not. And nowadays you can do sleep studies at home. They put a little thing on your finger and they have an answer the next day. And next, look at what you're eating and whether or not you get out there, take your shoes off, and walk on grass and just feel normal. It's lovely to tell patients you have no cancer, have a wonderful day. It's awful not to be able to fix it. So by looking at basic things like sleep, exercise, laying off the carbohydrates that we all know we shouldn't be using, and the positive attitude of I'm working my butt off, and yes, I'm tired. I need to relax, and it's going to get better. But you only do that once you have gone through the basics, looked at your blood, done the test I recommended. And don't be ashamed to tell your doctor, like my doctor friend told me, uh, my blood is normal. Why the heck do I feel terrible? Anyhow, have a lovely day. I hope this helps somebody, and best of luck to you.